Maybe closing colleges when you have an outbreak or numerous clusters is not the best thing to do. And that's not a foreign concept for us in public health, because if you have an outbreak occurring in an area, we like to contain and control that outbreak in that area, rather than close the institution that's having an outbreak and then have everyone disseminate out all over. And if they're carrying contagion, they're going to disseminate with that contagion. So this is a principle like if you're having an outbreak of diarrhea in a daycare center, don't close the daycare center, because parents need to have their kids watched so they can do what they need to do. And so they'll come up with daycare centers on their own, or take kids to other daycare centers, and then the diarrhea contagion can spread. Well, it's the same thing with COVID. So this was even brought up by Tony Fauci yesterday, that colleges should do what they can to contain and control the outbreaks where they are before considering closing. And I agree with that concept totally. And it's not easy, but it can be done. So if I think that'll be something that universities across the country are going to be looking at. And there's some schools who are having considerable number of cases now in other states that have not opted to close. The University of Iowa, for instance, University of Alabama, and they seem to be trying to they are staying on top of it and controlling it. Because for universities, actually one of the safest places, paradoxically, is in the classroom, because the classroom's a controlled environment, everyone is spaced out, people are wearing masks. And so it's probably better to keep classes going, which is a safe environment, rather than shutting down classes, and then which gives opportunities for the kids who are still on campus to socialize in other areas that may not be as safe. So here in the Triad area, actually, we have several universities, and all of them at this point are doing well. Wake Forest is at full undergraduate and attendance, and has been having classes now for more than a week. So far, so good. The number of cases have been very small, and you can look at their dashboard to see it. Elon, same way. Appalachian State also. And I believe also Davidson, Wingate, they're all doing fairly well too. So those are some schools in our area. Some schools have opted to stay fully virtual, and their campuses are not as busy. And so I won't mention those because things are going on there too. Herd immunity. We heard some this week. Some of the major newspapers were reporting that an advisor to the Trump administration is an advocate of herd immunity and a quote herd immunity approach to the pandemic. So what is a herd immunity approach to the pandemic? Is basically saying, you know what, all these measures that we're doing, let's just stop doing them. We don't need to flatten the curve anymore. We don't need to control transmission. We're just going to let everybody get it. And then we'll try to protect the vulnerable people at that time, and we'll let the amount of immunity in the population go up, and then the COVID can't transmit anymore. And that's how we're going to get out of this. I think the kindest way to comment on that approach is to call it controversial, because there are definitely pluses and minuses to just allowing a virus to run rampant through a population, so that immunity can be acquired by people. There have been examples of epidemics in the past where herd immunity was acquired. Obviously, the 1917-18 pandemic flu eventually was was pushed down because of herd immunity. There was no vaccine in those days. There was no really any other way to do it. But there were millions of deaths across the world from that. Medieval plague was extinguished because of herd immunity, and I don't think anyone would advocate that approach for plague right now, if that should occur again. And so the thing about herd immunity is, first of all, you have to be reasonably assured that the immunity to a virus is going to be long-lasting and profound. Do we know that for COVID? Well, there does seem to be immunity, I think, even in population-based studies. How long it lasts, we don't know yet, because it's not been around long enough to know. And there are areas in our country that have developed perhaps enough immunity in their population where you could think that their population might be partially protected to having another wave or another surge come through, such as New York City, parts of Chicago, so on and so forth. That immunity there tends to be very focal, so it tends to be even neighborhood specific, borough specific as far as it goes with New York. And so there are parts and pockets of that population there that would still be very susceptible. How much of a population needs to be immune to really push things down? Somewhere between 20 and 80%. How's that for a nice range? So I guess if you want to pick it in the middle, it would be what, 40%, somewhere in there. But it's not all or none. The more immunity you get in the population, the more help you get. And so if you think about it, how we protect ourselves, or how we can protect our communities from COVID transmission, what do we do now? Well, we personally distance, we wear masks, we avoid large gatherings. So if you think of those each as a discrete thing, 1, 2, 3, mask, gatherings and distancing, and then you add on some immunity, it's going to help. So as time goes on, there will be some help from it. What would happen though if we just completely said, let's just forget about it, we're going to have a couple bad 2 or 3 months, we'll all get sick, but that's okay because we'll get through it, but we'll protect our vulnerable people. All right, well, let's go through that. Well, so first of all, protecting our vulnerable people, how are you going to do that? Well, I guess if you look at nursing homes and really make them a true island and a true bubble on your own, you might be able to protect them. You're going to have to deal with staff members and people who take care of people in nursing homes who are getting sick. And if you don't allow them to come to work, are you going to have enough staff to take care of those people? Because the virus will be running wild through the population, a lot of people getting sick at one time. So let's extend that a little bit. Probably 70 to 80% of our vulnerable people in the United States aren't in nursing homes. They're in their own homes, or they're living with a family and other people. Or you could even have a 40-year-old who's working part of the workforce, and they have diabetes and heart disease. And so they're a vulnerable person. How are you going to protect them? So you can't just build a bubble around every vulnerable person in the United States. It's just not possible unless you want to herd them all up and put them in a camp on by themselves. And that's just not acceptable, obviously. So protecting vulnerable people, while it might sound good, is really not possible. The third thing is that if we have a lot of virus going through a community at a very, very high level and a lot of people getting sick, it's going to shut everything down. We're going to be like we were when we were in shelter in place, but we're going to be in that spot not because we're trying to keep from getting sick, it's because there are so many people who are sick. So if you have so many people who are sick and they can't work, How are you going to keep your grocery stores open, your hospitals open, your fire stations open, your police active, so on and so forth? And this actually was the problem during the 1917-18 Spanish flu pandemic, that where the experiment with herd immunity, because there was no other way to really for them to do it, and social distancing wasn't well worked out then, that it really got in the way of critical services. So it's just not a tenable support. So if we really wanted to do herd immunity, you got another option, and that would be to vaccinate once we get a good vaccine. And I think that's preferable rather than having communities that are just totally devastated by sick people, and probably somewhere around 2 million deaths, which if you think about that number of deaths, that means every family will be touched by COVID in a very, very bad way, one way or another, and if you think about the extended family. And I think most of us in public health would say that that's just not acceptable. So you'll be hearing more about the herd immunity approach. There's really only one country who's tried it with the COVID pandemic, and that was Sweden, and it didn't work well for them, and they ended up walking back on that approach. And by the way, Sweden has 100% coverage for health care for every one of their citizens, which we don't have here in the United States. If vaccine then, if vaccination may be the preferred way, where are we? There are several vaccines right now in phase 3 trials. They're moving forward. Minority enrollment and socially, economically disadvantaged enrollment is down compared to others, which is unfortunate, but the companies that are doing the trials are working hard to recruit people across a broad distribution of ages and ethnicity and race. And once they get up to 30,000 or so people enrolled in each trial, then we can start crunching numbers and give an idea how well the vaccine works and look at safety. To really know safety totally, we'll probably need a little bit more time. We'll know more about efficacy, which is how well a vaccine works, before we know about 100% about safety, because sometimes the safety issues come up a little late. I think once we have a vaccine that shows some efficacy, which means that it works more than it doesn't work, and then and that the early data shows it to be safe, then we'll move into production. So when will that happen? Well, I've saying all along that's probably going to be sometime in and around Christmas, late winter, maybe early spring. It takes a long time to make 1 billion doses of vaccine. If you think about it, just think about yourself in your own kitchen, canning, and how long it takes to make each individual bottle. It's going to take a very, very long time for a lot of these factories to do it. When I say very long time, I'm talking about months, not years. And then we'll have to figure out who to give it to first. I think the first people on the list for vaccine are going to be healthcare workers, people who work in nursing homes, and then our vulnerable populations. And when you think about how the logistics of doing that, it's really, you have to do a lot of planning, and you have to do a lot of stuff ahead of time, even before the vaccine is ready. So it's nice to have all of that set up and ready to go before the vaccine comes down. And that's one of the reasons I think that you've seen that in the announcement that the CDC is saying that states should have plans to distribute a vaccine by November 1, which means that their plans should be there so that it can be vetted and looked at and fine-tuned and then started to implement, because it's going to take months to do that. It doesn't necessarily mean there's going to be a vaccine by November 1. I think that would be pushing it, to tell you the truth, because the clinical trials won't even be totally finished by then. So if all of a sudden a vaccine came out on November 1, I think its efficacy data would not be totally 100% known. So I've been asked by a lot of healthcare workers, are you going to make us get the vaccine when it comes out? And how we do things in healthcare for vaccine is we wait until there's a lot of data behind something before we start making mandates. So healthcare workers are required to have a measles vaccine or show measles immunity. They're required to have hepatitis vaccines or show immunity. They're required to have flu vaccines in a lot of places. So there's a lot of vaccines we're all required to have to be a healthcare worker, and that's to protect the worker and also to protect the patients. But the data for those mandated vaccines, it was quite some time before the mandate came out. And we wait until there's a couple of groups of people at the CDC who weigh in on the data and the safety of a vaccine before mandating it. One is a group called HICPAC, which is a group of infection control and public health people for healthcare. And then the other is the APIC, which is the Vaccine Immunizations Advisory Group at the CDC. And they're not going to be coming out with recommendations for mandates before we have very, very good data about efficacy and safety. So there won't, I don't think, be an early mandate for healthcare workers to get vaccinated early on. And so I would encourage healthcare workers to get vaccinated when we have a safe and effective vaccine. And then I'll be pounding the table and asking people to do it. But until we know 100% that it's safe and effective, you're not going to see a mandate. Let's talk a little bit about something fun. It's hot, but here in the Triad, it's supposed to be really nice this weekend. And so there are going to be a lot of opportunities for people to get together. And at the same time, we are now relaxing a little bit more here in North Carolina to phase 2.5. So what is phase 2.5? So there's a few things that are going to be open that previously haven't been. Museums and aquariums can open at 50% capacity. It may take a few of the museums a little while to get it going again, restart the engines and get their staff back in. So whether or not they'll be actually open this weekend, please check before you go. But that includes children's museums, all the museums in Raleigh, all of the aquariums that we have in North Carolina, which are all very wonderful. And so that's gives us something more to do. When you go to the museum, wear your mask, stay personally distanced, and do everything that we've been telling you to do for the last few months. The other thing that's going to be open now are playgrounds. Yay for our kids who've wanted to be on a playground for months. Now they can do it. But as a parent, take a look at the playground. Is it crowded? Are other kids wearing their masks on the playground? And if it's not, then maybe go look for another playground or wait for another day. Because the more crowded a place is, and if kids aren't masking and being able to be personally distanced on the playground, it's probably better to pass for another time. And there's so many playgrounds around. You'll probably be able to find one that's not as crowded. Gyms. Boy, I tell you, this is the one that people have really been waiting for their favorite fitness center or the gym or the Y to reopen. They're going to be reopening at 30% capacity, which means they're going to have to be, particularly with the cardio machines, the step machines and treadmills and such, just moving them apart or shutting every other one down. The official guidance from the state is to have them 6 feet apart. It may be actually because of the machine itself and the fact that people are breathing real hard on these. Even more distance might be prudent. For some athletic centers, I've been advising them to try to keep them 12 feet apart, actually. And since you're going to be at 30% reduced capacity, 12 feet should be doable. So take a look at your facility if you're running one and think about that. The other things, some of the other activities in the fitness centers don't involve as much air movement from the participants, such as weight machines and weightlifting. And there the concern is not as high. What about classes and fitness classes? Well, I still think doing them outside is better if you can. It's going to start cooling off here. I'm not a weatherman, but it'll start cooling off as we get into September. And being outside will be nicer and it won't be as hot. So if you're going to do it inside, you're going to have to space yourself out and have a 30% reduced capacity in that room. So for some rooms, in some smaller fitness centers, that's going to mean there won't be a lot of people in the room yet. But as a participant, you have to understand that while exercise is good and it's good for you and it's part of a healthy lifestyle, you have to also understand there have been outbreaks of COVID related to fitness centers and gyms that have been published. Why is it a higher risk activity is because of all of the air movement. When you're exercising, you breathe hard, you breathe in hard, you breathe out hard. If you're asymptomatically infected, that's going to go out in the air. So how do you prevent that from happening? You would put a mask on. Now, masking during running really hard or bicycling really hard in a spinning class is going to be difficult because the mask obviously impedes some airflow. So actually during the activity itself, take it down, put it down around your neck. When you're done and you're moving on to the weights or to do something else, put the mask up and so on. We'll see how it goes. I think with the reduced capacity, moving things apart, I think we got a shot at keeping gyms and fitness centers open. But as a participant, think about it. And as with anything else, exercising outside is always going to be safer than exercising inside. Some things are going to stay the same with 2.5. The bars are going to stay closed. The 11 o'clock curfew on alcohol sales in restaurants is going to stay. Movie theaters will stay closed, as well as amusement parks and indoor entertainment, such as arcades and such, will stay closed. So that will have to wait for our numbers to get down even more for some of those things to stay open. So, what about gatherings? Well, Labor Day weekend, time to get family and friends together, go on down to the pool, have a picnic, and again, it's going to be great weather. Anything outside is always better than anything inside. The official gathering limits now for the state are 25 indoors and 50 outdoors. So 50 people in an outdoor activity, 25 in an indoor activity. I don't know about you, but the concept of having 50 people at my house for a backyard barbecue scares me to death. Not because of COVID, because of all the work involved. So I think that for your neighborhood activities and for family and friends, it's not like you have to strive to make 50. I would still try to keep things less than 10 if you can. Keep it amongst people that you know and that you kind of have an idea of what their individual risks are. Because as I've said before, when you fuse bubbles during these activities, you are assuming the risk of the other people in the other bubble. So if you think their risk is low too, then fuse your bubbles. But if you're not sure, it's probably better not to. So I still think a small activity is better, even though the official limits are higher. And while you're doing your activity, stay personally distant, particularly when you're eating, because when you're eating, the mask comes down. Stay spaced apart. Otherwise, if you're going to be closer for whatever reason, put the mask on if you're closer than 6 feet, even if you're outdoors. And have a lot of hand sanitizer available. If you're hosting an event, have it outside so people can use it. And hand sanitize before an activity, after an activity. If you're going to play volleyball, hand sanitize before, hand sanitize after, before eating, after eating, before bathroom, after bathroom, so on and so forth. And that's the best way to do that. So last, I did get a question. Is that with President Trump planning a rally next week in Winston-Salem, any concerns? What should people do to stay safe? Well, I've been saying all along that I'm not a big fan of large gatherings right now. I don't think that we're at a point in the pandemic yet that large gatherings are a good idea. And that would include rallies, that would include protests, that would include conventions, vendor buyer events, so on and so forth. I don't think we're at a point where those would be a good idea. But if you are going to go, then the same things apply. Stay personally distanced, wear a mask. Most rallies, people are close together. The best thing you can do is wear a mask. And it's responsible, and it's just the right thing to do. So if you're going to rally, mask up, hand sanitize a lot, and try to stay back from the throngs of people. So that would be my recommendation. Oh, by the way, I almost forgot. I should have mentioned it first on. So for those of you who are expecting a Halloween-themed day today and have been sending in recommendations for how to get through and how to have a safe Halloween. So we made an appeal last week that I would like ideas from people. I love a good Halloween, and I certainly love Halloween candy. I think there's ways to do it. And so if people out there have good ideas on how to do it and how for us to have a safe Halloween that would be free of viral transmission, please send in your ideas. We were going to discuss them today, but I'd like to give people another week to have some time to think and send those in. So we're going to talk about it next week. I'm going to bring in my pumpkin, and because Labor Day will be over, right? It's time to start thinking about fall. Halloween's part of fall. So we'll do that next week. Any questions from the group?
Is that something where, especially in this weekend, that maybe you should try? Hey, Tom and Jane will have the other, what would you do?
Right. Yeah. Yeah. So it's a good question. I'll summarize it. So the Rock, well, I'm not familiar with, but I did read the story. His whole family got COVID, and they think they got it with some family coming over that, or extended family, so not part of an inner family, where they had a gathering. Yeah, that happens. We've been talking about that all summer. The beach vacation. Let's get together some extended family at the beach house or at the mountain house. And when that happens, you're fusing somebody else's bubble with your bubble. And if you're not entirely sure what they've been doing and where their exposures might be, then you're going to assume the risk that they have, not the risk that you have. And so, yeah, I think it's okay to ask people questions. And, the things to ask are what have you been doing, where you've been going, do you mask? Do you mask at work? Do you mask at play? For adolescent kids, are they out with their groups? And when they're out hanging out together and doing their things, how are they doing it? Young adults kind of socialize and have parties more, and you can ask them. It's okay to do that. I do it with people and planning on getting together. So I think it's okay. It's socially acceptable. It's not crime, and it just makes sense. Another question? Yep.
You were talking about flu vaccines and how those supposed to be next year. But you hear all these different trials that are going, different types of vaccines and stuff. Are we going to end up with one? Or do you think there's going to be a couple?
Well, yeah, so that's a good question.
Which one do I take?
About COVID vaccines, you know, there's a lot of different trials going on, a lot of different vaccines, and they're made in different ways. Some are antigen-based, some are messenger RNA-based. Some probably will require 2 shots. There may be a few that only require 1 shot. I think most will require 2. So how do we decide which one to take? Well, the best answer is whichever one works the best. But you know, the information on how well they work is probably not going to all come in at one time, right? So you're not going to have a long list to choose from. You're going to know this one works at this level, maybe number 2 works at this level, and the rest you still don't know. So yeah, look forward to guidance. I've been thinking about that question myself, and how and which vaccines would I recommend, because there's different thoughts to that. So one would say, you know, the earlier we put a vaccine out, the more lives we're going to save, right? Because you start doing it earlier, and hopefully the numbers of deaths would come down. But others might say, well, what if that vaccine interferes with the vaccine that might actually work better that you will get later? So yeah, there's a lot of nuances. I would say for the average person out there, I don't think you're going to be making those decisions on your own. This is something where a lot of expert opinion is going to be useful, and I would be more than happy to help guide people as best I can as we go through that. Would the CDC say, would they come out and say go with this one, or would they say stand back and wait for that one? They could. They could. There'll be one group who'd be weighing in on this. DHHS would be weighing in on this. I would hope that politics don't get in the way of that, and that we actually do it with the best information and expert opinion and guidance that we can get. You know, and it's not just the United States doing this, right? There's a lot of other countries who are doing it too. So we'll all be sharing information on it. Other questions? Football is going forward, right? College football without fans here in North Carolina for the month of September. Other states may be doing it differently, but we'll see how the season goes. All right, see you next week. Halloween Thursday next week.